Welcome back to my channel, guys. Today we are going to discuss about cracked tooth syndrome. This is a situation where a patient come to you complaining of a very sharp shooting pain in his oral cavity, and when you hear the sharp shooting pain it goes to the pulpitis, right? And when you try to open his mouth, when you look inside it, you see no cavity, or sometimes there is a minor cavity, but you take the radiograph and you feel like this is not going to hurt it that much. Or a patient had a RCT, or it might be your ongoing patient who had a RCT 2 3 days back, and patient complained to that it hurting a lot. There's a very sharp shooting pain. Take the radiograph. You may feel that it is a flaring up reaction. It is the endodontic problem when in ongoing treatment patients suddenly have a very severe level of pain. You thought it's a flaring reaction, you thought that it is another tooth having a new cavity or maybe caries. Sometimes some doctors even rule it out as some kind of hairline fracture when when certain feature overlap with it. And after doing every possible diagnosis, you find out that it is nothing short of that. There is no cavity, there is no hairline fracture, there is nothing in the patient mouth. Then why it is hurting? Then you look deep dive into it. You ask the patient, when does it hurt? Does it hurt always or transient? Patient says it hurt transiently. Sometimes it, sometimes it don't. Right? So it is not a continuous pain. So if it is not a continuous pain, then definitely it is not a irreversible pulpitis at this stage. There is no pulpal inflammation at this stage. So you ask him, when does it hurt? Patient say during mastication. Okay. Patient say it hurt during mastication. That's good. Now you ask him, when does it hurt? When patient bite, when he bite, or when he release the bite. Patient says that it hurt when we release the bite. Okay. So you ask him, you are approaching the diagnosis. You ask him, so what will happen if you bite? You ask him, sir, what will happen if you bite? Patient says, sir, it give him relief. That's good. So it's a kind of pain which is transient, pain relief with biting, and it only pain occur when pressure release. This is your cracked tooth syndrome. This is a diagnostic feature. So now we understood what is cracked tooth syndrome, right? It's a condition which we have sharp pain during chewing, often without any visible sign of damage to the tooth. In some variant, patient have fractured in the crown or in the tooth. In some variant, there is no visible fracture. We will discuss that. Result from the hidden or subclinical crack in incomplete within the tooth fracture. It can be hidden, it can be subclinical, or it can be clinically evident, or it can be radiographically evident. Right? We will discuss that. So, if we discuss the symptoms, it will be a sharp, fleeting pain occur when releasing the biting pressure. This is the main symptom. If we hurt while biting, is due to PDL inflammation. If it hurt when releasing the bite, it is cracked tooth syndrome. Okay, pain is short-lived but can be severe. Why does it hurt? This is the tooth and a part of it which is fractured. So when patient bite, these both part meet together, and when they meet, it actually relieves the pressure because at that time pressure within the nerve is kind of relieved, so they are in relief position. But when suddenly patient relieve the pressure, the both of the fragment moves away. It's the similar case of repeated fracture. Like you press it, it relieves. Same thing happen when we have the fractured bone. When we align them together, it kind of relieves the pain. When we separate them, it hurt, right? So these are the diagnostic feature for cracked tooth syndrome. So how does cracked tooth syndrome occur? At region, it is something which happen with the age. It is very common in case of bruxism, in case of trauma, especially the boxers or the young child who are undergoing a lot of fight or a roadside accident or anything, right? Biting on a hard object. We youngsters have a habit of, opening the bottle with our teeth in that case, or eating very hard food like sometimes avocado or nuts, we try to break it with the hard with the teeth only, and that time we end up hurting her. And sometimes you chewing the pen only, we may damage it. This depend patient to patient because every patient have a different level of mineralization. Some people who have hyperplasia of enamel, they might have CTE in a very minor amount of pressure. Large restorations, these are, in cases, especially when amount of available sound structure is very less, and due to a huge amount of restoration, especially the amalgam or sometimes even metal restorations, which have a different level of strength, different level of fracture strength compared to the dentine, and when we apply a more amount of pressure, they break. Improper endodontic treatment, sometimes like overfiling. For example, this is the root and this is the available canal, but we prepared it like this. So the amount of bone available in this amount of tooth available, sound tooth available is very less, and due to overfiling or when we try to obturate the various techniques, the lateral condensation techniques, it is one of the problems with that is that we end up doing the vertical fracture. When we try to over compact the restoration or obturating material, we end up doing minor cracks within the tooth. So now we'll discuss type of cracked teeth syndromes. This is the classification by the American Association of Endodontics. The first one is graze line. These are superficial hairline cracks like these. These are not always visible, right? And you have to just try the tooth, clean it and view it very, very beautifully. You have to be very cautious about it to find out. You can't just look someone's mouth and you can't just say that it person have a cracked tooth syndrome. These things usually don't hurt. Sometimes there might be minor sensations, and most of the time they are just cosmetic. Sometimes doing some minor finishing and polishing will sort out, just minor finishing and polishing. Let me write it better for you. In these cases, treatment part is very easy. Sometimes you just need to do minor cosmetic changes like finishing and polishing. In a very rare case, rarely they need restoration. some desensitizing paste for sensation. Then the next one is fractured cusp. These are situation. There's two things: the fractured cusp and the cracked tooth. These things sound similar. Fractured cusp is a small chunk of the crown part is separated out. This is what happen mostly due to overbiting or in articulated tooth. This is very common in articulated teeth, and a small part of tooth is fractured out, and this thing can be treated very easily by either a dental crown or sometimes restorations or even onlays and inlays. Right? Onlays and inlays are sufficient in these cases. Then there's cracked tooth. Cracked tooth is basically when a part of the tooth is fractured up to the root. It is approaching the root but not yet separated into two different fragments. Not separated in two different fragments. This depends. In these cases, if they are situated, that's well and good. If not, then an RCT plus a crown is sufficient to treat them. That that's also depend on if the fractured part is too big. Then remove fractured segment followed by root canal treatment followed by post and core followed by crown. That's all. Right? Then there is a split tooth when it completely divided into two segments. In these cases, that's also depend on what is the available part. If the available part is, for example, this was fractured like this only, then we can remove it and then do the same thing we discussed earlier, RCT, then position core, then root prep. Otherwise, we might have to extract the tooth if it is approaching the root, it is involving a huge part of the root. Then the last is vertical root fracture. In this, these are most very common in articulated tooth. They have a small fracture line approaching the cervical line from the root apex. All of the fractures are from crown to the root, but vertical root fracture is from root to the crown. You will see a J-shaped radiolucency in the radiograph around it, periapical radiolucency. Sometimes you can rule out the fracture point. Sometimes you can rule out the fracture line. You will see the probing depth in these cases. You can rule out by the probing in some cases. Right, and for that part, treatment is extraction only. You can't do anything else. So this is the cracked tooth syndrome, and then the treatment part we already discussed. Just depend on the severity. We can do the stabilization, sometimes RCT, then position core, then crown. Sometimes a minor restoration can be done for small fractured segment, right? If they are not treated, then patient will have pulpal inflammation due to either continuous sensation or due to exposing of the pulp, and then we have to deal with it as an endodontic treatment. The prognosis very depend on the extent of the crack and the treatment. Extent extraction may or may not be needed, but especially in vertical root fracture, it is always and always necessary. In this split tooth, it is not mandatory, but in some cases we still need to do the extractions. So that's all for the corrective syndrome. We will meet again in our next lecture. Thank you very much.